Before doing so, I will put certain light over the anatomy of the larynx. Now, the anatomy of the larynx, the larynx has certain ligaments, like this one is the epiglottis. This is cartilage of the uh, epiglottis, which is unpaired. It is single cartilage. It is epiglottis. It is unpaired cartilage. Second one, you will see here. This one is the head bone, and these are the vocal cords. So it has the single unpaired cartilage, that is the epiglottis. Then it has the paired cartilage, which is arytenoid cartilage. This one is the arytenoid cartilage having the vocal process, and this is the muscular process. Now this vocal process forms the vocal cord. Anterior two-third it is vocal ligament, and posterior one-third it is a vocal process of the arytenoid cartilage, and these both form the vocal cord, which is very important because in laryngitis there is hoarseness of the voice, and hoarseness of voice is usually due to the involvement of these vocal ligaments, which is part of the vocal cord. So anterior two-third of vocal cord is vocal ligament, posterior one-third it is the arytenoid cartilage, which is a paired cartilage, means you have two arytenoid cartilage. Now every cartilage, this is the muscular, this is the process, vocal process, which is part of the vocal cord. This is the muscular process. This so theta is the and have the joint with the arytenoid cartilage. So this you see in this way. Next picture I will show you. You see this is the thyroid cartilage. Again, this is the single cartilage, unpaired cartilage. This is again the single cartilage or unpaired. So unpaired cartilages are the epiglottis. Here you will see the epiglottis. Second is the thyroid cartilage, unpaired. This is the cricoid cartilage, which is again the unpaired. Now the paired cartilages are the arytenoid cartilage, this one, and on the tip of the arytenoid cartilage, the carniculate cartilage, and the cuneiform cartilage, which are hanged in the aryepiglottic fold. This one is the aryepiglottic fold, which maintain the balance of the epiglottis. So in this way, you have the paired and unpaired cartilages. An important one is the vocal cord. This is the vocal cord, anterior two-third by the vocal ligament, and posterior one-third vocal process of the arytenoid cartilage. This is the area where you have the phonesia. This is the area where you have the production of the voice. Affection of this area leads to the hoarseness of the voice or change in the voice. Now, what is the laryngitis? It is inflammation of the mucous membrane of the larynx. Inflammation of the mucous membrane of the larynx or the voice box, because there is the production of the voice from the larynx. That's why it is labeled as a voice box. So inflammation of the mucous membrane. If the inflammation goes beyond the mucous membrane, then it is a complication. It will be not labeled as a laryngitis, but it will be one of the complications. So when the inflammation is confined toward the mucous membrane, it is called as a laryngitis. And this laryngitis, their reason may be the chemical, the upper respiratory infection, mechanical, or certain irritations from the dust, and it may be viral or the bacterial. Now the risk factors for the laryngitis is say like the cold, flu, bronchitis, sinusitis, pneumonia. Now what happens in the sinusitis? There's constant post-nasal drip, inflammatory material that from the nasal cavity towards the nasopharynx, pharynx, and towards the larynx and causes the laryngitis. Bronchitis and pneumonia, there's ascending infection from the lungs towards the trachea, then towards the larynx, leading to the laryngitis. So there are ascending infections and descending infections are there. Now then the exposure to the irritants like mold, pollen, pollutants. Now pollutants means the person suppose reside in area where there is the persist of he has to face the carbon monoxide from the exhaust fumes from like vehicles, or person who works in industries where he has to face the chemicals. So chemicals and the exhaust fumes from the vehicles also causes the laryngitis. Now the extremely cold weather and the excess alcohol consumption. Alcohol is again the chemical which causes the decortication of the epithelium. Now decortication is a word where you use when there's the, suppose you have to remove the bark from the trees or you have to remove the skin from the trees. So it is removal of skin from tree like that when the epithelium is removed, that what is labeled as a decortication. Now the etiology or reason behind the laryngitis. Voice abuse or misuse of the voice, like in the telephone operators, actors, singers, liars, teachers, and the coaches. Now they have to use the voice frequently. Now, if you look towards vocal cords, now when there is frequent use of vocal cords by the teachers, by the singers, by the hawkers, are the ladies who have the habit to use the voice loudly. What happens there is the vibration of the vocal cords. Maximum vibration of the vocal cord, then these vocal cords strikes frequently with each other. Then this frequency of striking of the vocal cords with each other leads to the damage to the epithelium of their surface. So there is damage to the epithelium of the surface of the vocal cord, and this leads to the edema, and after edema there is submucosal hemorrhage leading to the pain for voice and hoarseness of voice. So this shouting leads to the damage to the vocal cords, mucous membrane of the or epithelium of the vocal cords, which leads to the hoarseness. So this is the area which is damaged by the shouting. So this is the telephone operators, teachers, liars, where they use the voice very loudly, which damage the vocal cords. And you know the vocal cords are formed by the vocal ligament and the uh, vocal process of the. Now this is the lady which uses the voice very loudly, and then there is strain over the vocal cords or pressure over the vocal cords, and then there's damage to their lining. Now this is the teacher which teaches in the classroom and uses the very loud sound. Smoking also causes the irritation of the larynx, and you know in the smoking you have the nicotine. Nicotine again causes damage to the epithelium and causes the worseness of the voice. And then there are certain viral infections, allergies, laryngeal cancer, and the tumor. Alcohol comes, because you know the alcohol is a chemical which causes the chemical irritation of the larynx. Now this chemical irritation means irritation to the underlying mucosa, underlying epithelia of the vocal cords. As you know, in the sub uh, the you have three parts of the larynx. One is the just above the vocal cord, below the vocal cord, and the level of the vocal cord. Now, below the vocal cord is known as subglottic area. At the level of the vocal cord, glottic, above the supraglottic area. Now, this subglottic area below the vocal cord is very large. It has the much more space for the submucosal space. So, this chemical irritation also causes edema of the the space just below the vocal cords. Now, this is the gastroesophageal reflex when there is a reflex of the stomach content. And you know, in the stomach content, we have the maximum amount of the hydrogen chloride, which reflects backward from the stomach toward the esophagus and toward the larynx and causes the edema of the larynx and laryngitis. Now, other chemicals like we have the dust, we have the other occupational hazards, like the person who works in the occupation where he has to face the other type of the nitrogens and the carbon dioxide exposure. So these also cause the irritation of the larynx. Now there are two types of the laryngitis. One is acute and second one is the chronic laryngitis. Now the acute laryngitis. So acute laryngitis, and it is the inflammation of the larynx which lasts for 3 to 4 hours. That is sign symptoms which lasts for 3 to 4 hours. And you know the sign symptoms of the acute laryngitis. There is the hoarseness of voice. Hoarse change in the voice. Number two, pain during the talking. And if you see or the ideal larynx will be fully congested, and the vocal cords will be white in color because their blood flow is very low. So what happens if you see over the ideal, whole of the larynx will be congested, and in contrast, vocal cords look like very white in color. Now the etiology of the acute laryngitis, the other causative organs include the rhinovirus, parainfluenza virus, respiratory syncytial virus, adenovirus, measles, mumps. So these are all the viruses which causes the inflammation of the larynx. Then there is the diphtheria. Diphtheria is the again bacterial infection caused by the Corynebacterium diphtheriae. Now when there is the Corynebacterium diphtheriae, it usually these are the vocal cords. Two vocal cords are there. Anterior commissure, this one is the posterior commissure. So when there is the diphtheria, means the inflammation by the Corynebacterium diphtheria, it forms the membrane, which is very, very dangerous. Now, this membrane is over the larynx, pharynx, and over the tonsil. If you remove this membrane, it bleeds because it's tightly adherent to the underlying structures. So, when this membrane comes over the vocal cords, if it occupies this space, this is the glottic space, the space between the two vocal cords, it is known as the glottic area. Just above supraglottic, just below it is infraglottic area. So when this glottic area is occupied by the membrane, then this causes the death of the patient. So it is very, very dangerous phenomena when membrane is present in the glottic area. So you have to address that one very consciously. Now the vocal misuse we have discussed when there is vocal strain over the vocal cords, exposure to the noxious material like the carbon dioxide, monoxide, and then there are certain viral infections. Sometimes there is frank aphonia. Aphonia means when there is no talking. Person is not able to talk when there is a severe edema of the vocal cords. Now, the chronic laryngitis, when the sign symptoms of the acute laryngitis do persist beyond 3 to 4 weeks, these sign symptoms are the hoarseness of voice, painful talking, and over the ideal, you will see the congestion of the larynx. Then this will be labeled as a chronic laryngitis. So when the sign symptoms do last 3 to 4 weeks, then that is labeled as the chronic laryngitis. Now this chronic laryngitis leads to the hoarseness of voice, means where voice changes, and this chronic laryngitis usually painless. A person talks, he has the hoarseness of voice, but it is person does not feel the pain, patient does not feel the pain in chronic laryngitis. But in case of acute laryngitis, patient has the pain. When patient speaks, he feels the pain in the throat. That is difference between the acute laryngitis and the chronic laryngitis. In the chronic laryngitis, only you have the hoarseness of voice. In acute laryngitis, you have the pain along with the hoarseness of the voice. Same things, vocal misuse, exposure to the noxious agents, infectious agents leading to the upper respiratory infection. Infectious agents are most often viral, but sometimes you have the bacterial. Inhaled irritants such as chemical fumes, allergens, smoking, acid reflux also, esophageal reflux, that is the hydrogen chloride which comes from the stomach, damages the esophagus and the pharynx, then the larynx, which causes the damage to the epithelium. This is known as the decortication of the epithelium of the larynx. Now this is the chronic sinusitis, which causes the post-nasal drip, doubling of the infected material from the sinus, nose to the nasopharynx, pharynx, and to the larynx. This is a descending infection, whereas bronchitis means inflammation of bronchitis. When the lungs are involved, then the infection is ascending nature, which goes toward the lung, from the lung to the bronchus, to the trachea, then toward the larynx, causes the laryngitis. Habitual overuse of vice such as for the singers, the cheerleaders, smoking. Now, less common cause of chronic laryngitis includes the tuberculosis, syphilis, or fungal infection. Parasites are there, cancer is there, vocal cord paralysis. You know the vocal cords are supplied by the recurrent laryngeal nerve. So when there is the cerebrovascular accidents or stroke, the tumors of the lung, that causes the vocal cord paralysis. And you know the vocal cord paralysis, left recurrent laryngeal nerve enters into the lung, then it ascends upward to the vocal cord. So lung tumors are lung inflammations, which causes the paralysis of left recurrent laryngeal nerve and causes the vocal cord paralysis and the worsening of voice. And when there is a brain tumor, it affects the whole vagus nerve and causes the paralysis. Now the pathophysiology, Due to etiologic factors, the mucosa becomes congested and may become edematous. A fibrinousness exudate may occur on the surface. Sinus symptoms, the sinus symptoms will be the change in the voice, means the hoarseness and the pain. Sometimes infection of the pericardium and the laryngeal cartilages, which is pericarditis. Now, pericarditis, when there's pericarditis, is always very painful because pericardium is richly supplied by your nerves. Symptoms of the hoarseness, change in the voice, but low, raspy voice loss, tickling sensation, and hardness in the throat, voice that tires easily, breaks or cracks, a sensation lump in the throat or dry throat, difficulty in swallowing, cold flu-like symptom, fever, swollen left nose, neck. Now, difficult in the swallowing whenever there is involvement of the cartilages, because cartilages has abundant blood supply. And when patient swallow and larynx goes upward due to the pull of the certain muscles, patient feel the pain and also has the dysphagia. Now the constant urge to clear the throat, heavy mucus in the throat, chronic cough, postnasal drip, dysphagia, coughing. Now difficulty in the breathing. Children face the added risk of encountering breathing difficulty because opening of child larynx narrow to begin with, and inflammation restrict the air passage even further. Feeling of fullness in the throat. In the child, this laryngitis is very, very dangerous because submucosal space is very wide and the inlet of larynx is narrow. And subglottic area is very, very spacious. So whenever there is edema in the subglottic area, that causes the closure of inlet of larynx, and sometimes you lose the patient. Diagnosis diagnosed based on the complete history and the physical examination. And if symptoms are very severe, then you should go for the X-rays and you like the complete blood picture. And these techniques are sometimes used to help the diagnosis of laryngitis. Laryngoscopy. You see, the laryngoscopy is very, very important. Hmm? Are you getting my voice, please?
Yes, sir.
Okay, okay. Thank you very much. Thank you very much. So the laryngoscopy of two types. One is the flexible laryngoscopy where you use the fiber optic material and you use the local anesthesia where we see the movements of the vocal cords. Where one is the rigid endoscope, we use this under anesthesia, general anesthesia, where we see the movements of the vocal cords. Biopsy, whenever you suspect there is a mass or tumor, then you should go for the biopsy. Now, if you go for the picture which I have shown you earlier, when you will take you see this is the picture where we use the spatula to press the tongue downward to see the epiglottis. In children, epiglottitis is very, very dangerous disease. Sometimes due to the epiglottitis, due to hemophilus influenza, what happens, there's a swollen epiglottis. If you go for the X-ray, the shape of X-ray is like a turban, thumb like this over the, and you see the depress the tongue through the spatula, you will see the epiglottis will be swollen. Now this is very dangerous. If that material, that inflammatory material trickle downward, the inlet of larynx is very, very low, very, very narrow. So if it is occupied by that inflammatory material, then you will lose the patient. Now in this way, in case of epiglottitis, put the patient over the antibiotics and the corticosteroid. Here corticosteroid is used to make the edema very at low level. Otherwise, there is the edema of inlet of larynx which leads to the taste. Now you see, and if you go the picture of the vocal cords, you see this is the picture of the vocal cord. Now in adult, the length is 24 millimeter. In adult male, its length is 24 millimeter. In female, its length is 16 millimeter. That's why pitch of the male is higher as compared to the female. Now this is the vocal cord. Their length is 24 millimeter in adult male and 16 millimeter in the adult female. But in case of the children, their size is very much minimal, 9 millimeter, 6 millimeter, and the space between the two vocal cords, which is 3 to 4 millimeter, is very narrow in children. If there's an inflammatory material which is causes edema of the vocal cords, and if there's maximum edema, so this space between two vocal cords occupied by the edema, and then there's no any penetration of the air from the supraglottic to the infraglottic area, and this way you will lose the patient, and then you have no option but you go for the tracheostomy to save the life of the patient. So this area is very, very important. The area between the vocal cords and just below the vocal cords is the subglottic area. Subglottic area is again very, very important because this is the area where your submucosal space is very tenacious, wider, very loose aerial tissues are here, so edema becomes very, very vigorous here. You cannot minimize edema where if subglottic area is closed one, again there is no entry of the air and you lose the patient. So you must see whenever there is the edema of this space, glottic space, then you have no option but you go for the tracheostomy. Now if you further go, you see details of that one. So there are the certain pictures. Now, if you see here, this is the vocal ligament and this is the arytenoid cartilage. Vocal process of the arytenoid cartilage, this muscular process of the arytenoid cartilage. Now in children, their space is narrow one as compared to the adult one. If there is the epiglottitis, this is the inflammation of the epiglottis. These are the epiglottic folds. Now, if there's inflammation of this epiglottis, and over the X-ray, if you see there's a thumb impression, like their shape become like a thumb, turban-like structure over the X-ray lateral view of the neck. If you go for the X-ray neck lateral view, you will see the turban-like structure over there. Now, if that inflammatory material, inflammatory material, you have histamine, serotonin, gamma, butyric acid, if that trickles downward and then this goes toward the vocal cord, then this space is occupied by this inflammatory material, edema, and then there's no space for the air to come from the supraglottic area to the infraglottic area, and this way you will lose the patient. Are you getting this picture, please? Are you getting this picture, please? Are you getting this picture, please?
No, sir.
Yes, sir.
Are you getting this picture? Okay, okay. So this is very important picture because next lecture which we have is the vocal cord and vocal nodule and vocal polyp, which is very, very important. And sometimes you will get the question what is difference between the vocal nodule and vocal polyp, because both these diseases are pertaining to these vocal cords. That's why this is very important area, very, very important area. And if there's any edema of
Sir,
the glottic area, you will lose
laryngoscopy
the
slide
patient.
is shown. The slide
Yes,
of laryngoscopy is being showed.
slides of
Laryngoscopy is being showed.
laryngoscopy.
Yes, sir.
Okay, okay.
Slide. This
Oh,
slide is going on.
okay, okay. Now what happens? This is the epiglottis. This one is the epiglottis inlet of the larynx, and these are the vocal cords. Now our main aim for the laryngoscopy to see the movements of the vocal cords, to see the space between the two vocal cords. That is the main aim of the laryngoscopy. Whether you go for the rigid laryngoscopy or the fiber optic, main aim is to see the inlet of the larynx, whether edema is minimal or maximal. If edema is minimal, then you have to go for the tracheostomy or laryngotomy. Now this laryngotomy is done, you have to make the just puncture over the just below the vocal cords in the subglottic areas. So this is that's why my aim is to show you the vocal cords, because next lecture which is on the vocal nodule and the vocal polyp is very, very important pertaining to these vocal cords. And endoscopy, whether it is flexible or the rigid, is done to see the movement of the vocal cord. So that's my focus is on the vocal cord, because these are very, very important, having the vocal ligament and the vocal process. So again, we are shifting over the endoscopies. Now you see this is the thyroid membrane and cricoid membrane. This cricothyroid membrane is very, very important. Just here you have the vocal ligaments. Now if you
Sir,
see,
slide नहीं आ रही है.
you are not getting the
Slide.
picture. You are not
No,
getting
sir.
the picture. Oh,
सर स्लाइड्स शो नहीं हो
सर
रही.
अभी आ रही है.
picture nothing.
सर अभी सही है.
Are you getting the picture? Now you are getting the picture?
Yes, sir.
Okay. Now you see this is the hyoid bone. This is the thyroid membrane. This is thyroid cartilage. Now this is the area where you have the laminas of thyroid cartilage. This area where you have attachment of vocal cords. Now this is the thyroid membrane. This is the cricoid cartilage. Now when this vocal cords get infected and there's no air entry, then you have to just puncture the cricothyroid membrane to save the life of child. This is very, very important. Cricothyroid is very, very important in children because there's no time for you to go for the tracheostomy. Yeah, shift the patient over the operation theater. Just give the incision over the cricothyroid, even with your knife, single knife if you have. Even you can use scissor. Sometimes you can use the scissor over here if you have to save the life of child. Otherwise, you will lose the child because inlet of larynx of the child is very, very narrow. So this is the very, very emergency inlet, that is cricothyroid membrane, which is very, very important. So the main aim of our purpose is to see the status of the vocal cords. They are inlaid in case of the endoscopies. So this is the area where we go for the endoscopy. Now again we are shifting over the endoscopies. So this is the laryngoscopy having the two types. One is the fiber optic. Main aim is to see the movements of vocal cords, their inlet, and it is used in the local anesthesia. Where we have the rigid endoscope or laryngoscope, it is seen through the uh, general anesthesia, where patient is put under the certain drugs to see. The aim is to see the movement of the vocal cord and inlet of the vocal cord, and then for the tracheostomy purpose. Biopsy. Now, if you suspect the mass is present, edema is present, which is very, very dangerous, having the dangerous designs, you can take the biopsy and send for histopathology to see the disease. Now, biopsy is taken under general anesthesia in case of larynx, because the larynx is a very, very sensitive organ. If you go for the biopsy in local, in the flexible endoscope, then sometimes you have the laryngeal spasm. Now, once there is a laryngeal spasm, it is very, very difficult to relieve the patient from this spasm. The larynx, certain muscles like a cricothyroid muscle, cricoretinoid muscle. Now, if this cricothyroid muscle get contracted, then the inlet of the larynx becomes closed. Very, very difficult to open it. So it is better, if you want to take the biopsy, be do it proper manner in operation theater, and all facilities are available, and it is done under general anesthesia through the rigid endoscope. Do not try or take the biopsy in the local anesthesia because of fear of the spasm, especially in children. Please avoid the biopsy in local anesthesia, flexible endoscopy, because of the danger of the spasm of the larynx. So always go for the rigid endoscopy under general anesthesia in operation theaters where you are fully equipped, and go for the biopsy and take it and send for histopathology. Treatment. Treatment is very, very easy. If you found there's high fever with sore throat, then you go for a certain antibiotics. If there's a cough with yellow green, you go for the antibiotics. If there's a cough, you go for soothing agents. Usually these are the certain signs symptoms are also there here. Now this is very important. Supportive therapy, very, very important. This is the mainstay of treatment. Supportive therapy. Wise rest, very, very important. Number two, steam inhalation, very, very important. Avoid smoking and cold. Fluid intake to boost your immunity. Wise rehabilitation, humidification, increase intake of fluids, reduction of the high impact stress to the vocal cords caused by the loud, frequent, and high pitched sound. So this is the mainstay treatment. Ask the patient to take the widest steam inhalation with the tincture benzoico to make the thick secretion into thin, so that can be easily get out of from the larynx. Avoid smoking, fluid intake. Please note down, this is very, very important slide. Now the medical management, you have antifungal, antibiotics, short course of steroids, H2 blockers in case of the gastrointestinal reflux, analgesic can be given, and this is the nursing management, which is very, very important, very, very important. Do not smoke and avoid passive smoking. Smoke dries the throat and irritates vocal cords. Smoke dries the throat and irritates the vocal cord. Then drink plenty of water. Advise patient to avoid the cleaning the throat. This does more harm than good because it causes an abnormal vibration of the vocal cords and increase the swelling and causes the throat to secrete more mucus and feel more irritated. If you go for hacking frequently you go hacking, that causes the abnormal vibration of the vocal cords. Avoid upper respiratory infection. Make sure anywhere flow short as per the recommendation of doctor. Wash hands more often. Avoid contact with people who have upper respiratory infections. For relieve the symptom of laryngitis, use the humidifier. Here we use the tension benzoico to make the dry air moist. Then drink plenty of fluids. Avoid alcohol and caffeine. Give your voice a break. Rest the voice when you are possible. Inhale steam and breathe in steam from a bowl or hot water or hot shower. These are the again the vocal cords. You see, the vocal cords are there, and then there is the mass is present on the vocal cords. So this mass is removed or biopsy is taken under general anesthesia, not local anesthesia, because sometimes there is edema or vocal laryngeal spasm. Then it is very, very difficult to remove. So these are vocal cords, and mass is present over the vocal cord. Then prevention, wash hands before touching the face, hemophile influenza vaccine for children to prevent the possibility of life-threatening infection, prevention of the overuse of ice, home remedies, avoid shouting, do not whisper, breathe through nose, stimulation, use a humidifier, drink a lot of water, drink lemon and honey mixture, moisten throat, say no to decongestant, avoid throat cleaning, avoid smoking. Thank you very much. Any question for the laryngitis? Next time we'll discuss the vocal nodule and the vocal polyp. Very, very important topic. Next time we'll discuss the vocal nodule and vocal polyp. Now, please, any question from the laryngitis? Any question, please? So next time we'll discuss the vocal nodule and vocal polyp. What is difference between vocal nodule and vocal polyp? Very, very important. You will get the essay over that one. What is difference between vocal nodule and vocal polyp? Very, very important. Any question, please?
No, sir. Thank you.
Thank you very much. Thank you very much.
सेव क्या